I generally use the word killing yourself when I raise suicide. And the reason I do that is twofold. First of all, trying to figure out how to make the best empathic resonance with a patient, because it's so important that they be comfortable with me for them to share this incredible secret.